just by way of introduction, I'm a nurse and I work at Royal Prince Alfred in Sydney, and I'm a myeloma nurse consultant there. I have been doing that for a couple of years, but I am from England, and over there my sort of pedigree is to have spent time nursing in the field of bone marrow transplant, and then I got involved, care of a friend who has a cousin of myeloma. We got involved with the International Myeloma Foundation, and I got involved doing a lot of advocacy, and similar to Rebecca and Amy actually, working with patients and carers, and also teaching nurses, etc. And then I came over to Australia to travel, which I haven't really done yet because you need money to travel, so I needed a job, and so I've fallen back in with the Myeloma Foundation, and more recently with getting a grant to do some research at Sydney University in the field of multiple myeloma. So currently I'm doing some research under the supervision of Professor Kate White and the Cancer Nursing Research Team, looking at what it's like to have myeloma, what your information needs are, and I'm just about to start a study looking at what it is like to be a patient with myeloma taking high-dose steroids. So some of you may, yes, some eyes rolling, and goodness, I know I'm going to expect what I'm expecting to find, what it's like to be living with high-dose steroids, but it'll be interesting to follow the process of research, qualitative research, and follow that through, and then hopefully publish some findings and see if we can perhaps think of a better way of managing people on certain drugs and toxicities. And yes, it is. That's it. Yes. So what Amy and Rebecca asked me to talk about today, because obviously I have been told that I can talk about myeloma under wet cement. I'm likely to stand up here talking way after you guys have all gone home for your lunch. But we decided it might be pertinent to focus on the aspects of managing the complications of around myeloma, and particularly around the side effects of some of the treatments. Nevertheless, I thought I'd start off with 5 or 6 slides just reminding us what myeloma is, and to also perhaps inject into this presentation some of the latest directions in how we're managing not only the disease but also some of the complications, because I was lucky enough to go to the International Myeloma Workshop recently in Paris, purely on a reconnaissance so that I could inform you better today, and that's what I told the girls last night. But no, I was lucky enough to go, and this is an international meeting that brings clinicians together from around the world who have an interest in research, laboratory research or clinical research in the field of multiple myeloma, and only myeloma and some of its rare cousins. And this meeting was the biggest they've had so far, probably because it was actually held in the Louvre in Paris, which I think was a bit of a pull for some people to actually go. This is the Louvre. Has anybody been to the Louvre in Paris? Magnificent museum, isn't it? Yes. And there is actually, in the concourse underneath, there's actually a conference centre which looks like this. So if you ever get to go to a conference, whatever it's on, if it's in the Louvre, I suggest you go, because we were lucky enough actually to have a private viewing of the Louvre for our sort of supper, our conference dinner, which didn't involve any food. It was just a glass of wine and a look around the museum, but we had sort of access to that without the general public. So that was very exciting. And you can't really see in this photo, but this is to prove that I actually did go, is that this is actually a photo of the Mona Lisa. Can you see her perhaps there? That's her chest there. Yes, and me pointing very to show you where the Mona Lisa is, but it was nice to be able to do that. So what I'm aiming to cover today, and we've got about 2 hours, we might break halfway through if that's okay, and what I often do in these kind of sessions lends itself to learning from your experience as well. And so if people would like to ask questions as we go through, perhaps we'll maybe ask questions after each sort of section, then do feel free to do that. Because we're taking the opportunity to film today's session so it can be made available to people who are not in attendance today, I may actually repeat the question you ask, so don't think I'm being silly if I just say back to you exactly the question you've asked me, or Amy or Rebecca will have a microphone, and so just wait till they get to you to ask that question. Or what we can do is have a clump of questions and open discussion at the end of each section, whatever you feel like. So I'm happy to just go with the flow, but if you have a burning question, and if you're like me, if you don't ask it, you'll forget it, do ask it or write it down and ask at the end, okay? So this is what I'm hoping to get through today, but I'm also very happy if there's an aspect relating to myeloma or your health relating to myeloma, I don't know a lot outside of myeloma, then please do ask, even if I've not covered it in some of the slides, okay? And I'd be happy to help answer those questions. So, what is myeloma? Multiple myeloma and myeloma are exactly the same disease. I tend to drop the multiple, but I'm talking about the same thing. So please don't get confused when I do that. It's often quite helpful to call it multiple myeloma because it helps differentiate it from that very, very well-known cancer, melanoma, which many patients at diagnosis often think maybe they have, or certainly perhaps your relatives or your group around you may well get confused. I've had been at advocacy and information stands where I've had people come up to me and actually expose themselves and saying, oh yes, you're from that foundation, fantastic. Could you have a look at this mole? And up comes their shirt for me to have a look at a mole. And I have to say, no, it's not melanoma, which is a skin cancer. It's multiple myeloma, which is a very there is a lack of awareness in the general community about it. I'm sure you'd probably all some nodding going on, it relatively lacking of awareness in the general cancer population as well, including healthcare professionals. So myeloma is a cancer of the plasma cells. I'm sure you're all very aware of that. All well and good. Did anybody really know what their plasma cells were before they knew they were cancerous? Perhaps not, no. So we'll help explain that. And this disease is characterized, plasma cells are a very important blood cell that lives and grows within the bone marrow. And its role is to produce antibodies to help us fight in response to infection. So already we can see that if we've got a cancer of our plasma cells, we've got something wrong with our blood, we've got something wrong with our immune system, and we're probably producing abnormal antibodies, or our antibodies to help us fight infection are going to be impaired. So it's not surprising then that this type of cancer is characterized by an impairment of our bone marrow. All well and good. Did anybody really know what their bone marrow did before they realized they had a problem with it? Not really. We take a lot of bits and pieces for granted, don't we, in our body? Well, the bone marrow is quite simply the factory of the blood. Within the bone marrow, which in a healthy adult is predominantly in the sort of top of the long bones and the pelvic area, is the factory of our blood. It produces a lot of the blood cells, the red cells that help to carry oxygen and give us energy, platelets, which are the first line of defense if we have a cut, and a whole range of different white cells and immune cells that help us respond to infection. And so this is where your disease lies. So when you have a problem with one of the cells within your bone marrow, it's not surprising that a lot of the blood system goes out of whack, because that's where your disease lies. So there's also an impairment of the immune function because these plasma cells are being produced in abundance, but they're not being produced effectively. So although you have far more plasma cells than you normally would and far more antibody, it's not actually effective against fighting disease, fighting infections. What sets this disease aside from some of the other blood cancers and blood disorders, though, is that these plasma cells interact with bone, and they can cause bone loss, and that bone loss can result in pathological fractures or a fracture of a bone without having had an injury to it, and most commonly can result in bone pain. Did anybody come to a diagnosis of their multiple myeloma actually because of a bone problem? Yes, lots of hands going up in the room, and that's very common. It's probably the most common thing that brings somebody to a diagnosis of myeloma, is either a bone pain without another explanation or a fracture that has occurred with no good reason. So that sets it aside, and we're going to talk about that as we go through the morning. And we also have with this cancer an abnormal antibody that is produced, which is the major marker of your disease. Has anybody heard of tumor markers or cancer markers? Well, this is your marker. This abnormal antibody is produced, we might term it an M protein or a paraprotein, and it is found in your blood or your urine, and we use that to measure how much myeloma is around, and also periodically to measure how well you are responding to the treatment that you are taking at any given time. And just by way of explanation, you might wonder what this fella is doing up here in these images. These images just show these plasma cells within the bone marrow, and these have been dyed and showed up. And in order to diagnose the disease multiple myeloma, your doctor will have had to take a sample of your bone marrow with that rather pleasant test called a bone marrow aspirate. Yes, yippee, says somebody down here. The number one no-no out of all my patients, I think, is the bone marrow test. But these plasma cells, although they have this marker that is in your blood, these plasma cells only live in the bone marrow. So certainly at diagnosis, we need to take a sample of your bone marrow to make sure that the suspicions that you might have multiple myeloma are actually true, and we can look at it under a microscope and identify the plasma cell which is being produced in increased numbers and is abnormal in appearance. And then periodically we need to do that as we restage to find out and assess how things are going. So that is a bone marrow test, and then this molecule here is just the immunoglobulin molecule, or the antibody. You may have learnt by now that in medicine and healthcare, if we can call something 4 or 5 different names just to confuse you, we will, okay? And it confuses us as well. But when we talk about your immunoglobulins or antibodies or your M protein, we're kind of talking about the same thing, perhaps different ways of it behaving, but we're talking about this protein that is made abnormally by your cancerous plasma cells, and it informs us, it tells us a lot. It tells us how things are going, how much myeloma is around, and more importantly, how well you are responding to treatment and whether you need to change to a different one. And then this fella here, I was saying last night to the nurses when I was teaching, I said to the nurses, oh, you know, and who do you think this fellow is here? You know, his name is not Mr. Myeloma, but he's quite an important fella historically in our understanding of this disease. And somebody at the back said, is it Charles Dickens? And I said, why on earth would I have Charles Dickens on a slide about multiple myeloma? And she's quite sheepishly realised she'd probably made a bit of a mistake, and she said, well, he could have had it, maybe he had it, and we found out he had it, and he's kind of one of the first reported cases, but we don't think Charles Dickens had myeloma. But this is a gentleman called Dr. Henry Bence Jones. And he pretty much is Mr. Myeloma, really. He first identified in the 1800s this abnormal protein in the urine of patients that had what we now know to be multiple myeloma. And as all good physicians did in that day, named it after himself, and it's become linked to his early research. So that probably is Mr. Myeloma up there. So it's always helpful, and patients, particularly around a diagnosis of myeloma, always focus and really want to find out about the statistics of their disease, something we call epidemiology. So I thought that might be helpful to include. Myeloma is a rare cancer, which perhaps partly explains why there is such low awareness of it. Slightly more men than women have multiple myeloma, and generally it affects people in their 6th or 7th decade. Saying that, I manage a fair old population of patients in their 20s, 30s and 40s, so there are people who are diagnosed earlier, but on average, if you look at the data, you will see that probably 65 to 70 is the average age of diagnosis.